Hey, this is Dr. Maqsood Chaudhary. I am a dentist in Northern Virginia and I work with Department of Behavioral Health and Developmental Services. And today we have with us the program manager of that program who manages the dental services of that program, Casey, and she is here with us and we are going to talk about this program, how it's when it started, why it started, how it's beneficial for the community, which has been ignored otherwise if this program would not have been started. Casey, you would like to add something in that?
Sure. My name's Casey Tupea and I'm a dental hygienist. I work for the Department of Behavioral Health and Developmental Services and I work in the Office of Integrated Health. And the Office of Integrated Health is in charge of creating community programs, medical and nursing, technical nursing assistance, mobile rehab engineering, and dental services in the community. And those programs were to replace the programs that began in the training centers that started closing in 2014.
Yeah, it has been a long time. The training center was one of the facility where these people, some of the patients, when we talk about these special need patient, that means the patient who would have not been seen otherwise in the dental offices. They have either with autism, with other kind of intellectual problem where they cannot behave well, and most of the time they come with a wheelchair and a lot of other medications. Some are epilepsy and some other problem, debilitating diseases. So when they go to on the wheelchair in dental offices, the dentists, as soon as they see it, they are not equipped to do that. I remember when I was in my dental office, if somebody walked in with a wheelchair, my first thing was talking to my staff, where should we refer this patient? We cannot see this patient. But now those patients who come, we look forward to help them even from their car. When in my office, when they go there is a door. Of course, the door open itself, but to get the patient out of the car and bringing them to the office, we help them even to bring from the car out. Normally, when the patient was walking before, when I started with this program, I was just even the patient is in the waiting room, was saying how we can refer. So these patients need a special care, and we design our office in a way that can cater their need. And Casey has been very helpful, and she and Dr. Don mentored me to get into this program, and they also helped me to get some more higher education for that program.
Hi, my name is Teresa Champion. I'm the parent of a 26-year-old young man with disabilities. He has a diagnosis of autism and an autoimmune disorder called PANDAS. We've been trying for several years to get medical care, medically necessary care for James that has been prescribed by his physician, paid for by insurance, and has been denied by providers. But because James receives the Medicaid waiver through the Commonwealth of Virginia, he's entitled to medical care through the Medicaid waiver. For many years I've tried to get a provider. Currently he doesn't even have a PCP. But I was able to reach out to DBDHS, and by the grace of God met Casey, who is a nurse at DBDHS. She came out to the home and saw our situation. I told her our story, and I was able to explain to her the inability to get collaborative medical care for my son, who also needs dental care, and he also needs eye exam. He needs just a whole host that he cannot go to a doctor's office to receive. So she was able to work together with a dental sedation unit and also with a dentist's office to bring the care into the home. At the same time, while he was sedated for the dental care, we were able to infuse him with the medically necessary immunogammuglobulins. So he's also receiving treatment that was prescribed by his physician that he was unable to receive before. This is all because when they closed the training centers in Virginia, they closed the ability and facilities for people with special needs to go get medical care. That care was supposed to follow them into the community. It did not, because once you don't have that facility, or you don't have that brick and mortar, you don't have that contract with the doctor, then private providers aren't necessarily willing to provide the care. So I'm grateful for the opportunity to have the collaborative medical dental exam that's needed for my son that we were unable to receive any other way.
And how did you find Dr. Chaudhary's performance and treatment today?
wonderful. I mean, everybody has just been so kind and so gracious and so caring. For someone with special needs who can't self-advocate, it needs a very special care provider to understand those needs and to really anticipate the type of care that they would want to receive, and to be very gentle and caring. And I'm so grateful.
In 2017, I was approached by Casey to start developing a program to help special needs adults by providing dental sedation to them while they went to a community dentist office. My partner, Holly Price, and I, we started giving the sedation at Dr. Chaudhry's office, the Dental Center of Tysons Corner. We've been doing it since September of 2017, and we have almost 500 patients in the IV moderate sedation program. We give the sedation in varied forms. Some patients require less than others, and we do pre-op evaluations on all patients, review their charts, and have them come into the office where we give them the appropriate amount of sedation for them, and then we send them home. We have repeat patients who are doing much better in the program. They're able to come into the office and require much less sedation than they did before. And we are still continuing to treat the patients. We now have a patient that we've been treating at home because he is homebound, too afraid to leave his house, and has complicated medical issues. He needs dental care, so we have sedated him, we have drawn blood, and we are looking at his case and giving him comprehensive history and physical, and getting his care coordinated so that we can better help him and his family.
And Casey, when you came last time with Dr. Don, remember we have an interaction, we talked about this program, and you will take from there? How
Yeah.
was it?
So that's right. As a result of the training centers closing, there have just been thousands of individuals in the community who lack comprehensive dental care and other services that they were receiving when they were either patients at the training center that resided there, or they simply went there as a community patient. And so what we're doing is we're creating an infrastructure of dental services with Dr. Chaudhry's help, and a few other dentists that have contracted on with us, and what we do is our office refers patients to places like Dr. Chaudhry, and we see them in an office setting. But today we're in a unique situation because we have homebound cases out there that cannot go to a facility to be treated, and so we have a mobile unit like you see behind us, and we can either go to a facility, a day program, a house, and have the patients come into the van, or like today, the patient is unable to come out of the house, and so we take our equipment inside, and Dr. Chaudhry comes and joins us here on site at the patient's home too.
With our other team member, well, we have very highly specialized and skilled CRNAs, which really have a lot of experience in dealing with the patient with this disability. And look at this way, starting from the office, either the patient is getting in the office, we treat them there. If they cannot come to the office, we have the van, and you can see the integrated health services. The county has started this program and to help those patients. And if they cannot get in the van, then we are here to go into these houses, and we can take care of their need over there. But this is something which we look in this way, the helping even one person at a time and saving their life is like as you have saved the humanity. So we have a passion for this one, and we like to do that.
Yeah, and in addition to the help that we're giving to these individuals, we're connecting resources. So we're connecting the dental resource, and then from there we can start to build a comprehensive care plan for these individuals with other professionals that we know. And so when we are working as a team for some of these special cases, we can identify other things that they're lacking. Primary care physicians and specialty doctors that we can kind of loop in as we go along with our dental care, things that we notice along the way.
Not only that, the medical services, when
Right.
the patient come in with those once they are under IV sedation and they are sleeping, we let their guardian or their parents come in. They can clean up their hair, trim their hair, They can even clip their nails. We draw the blood for them. Those otherwise that would have been another hassle when they go to the physician. They are not controlled, so they have to go to the hospital just to draw the blood. And in that facility, we are able to provide all those services along with that as the additional benefit. Our dental center of Tysons Corner. We are here at Tyson Corner, center of the city, and as you have seen outside, very nice building. As the patient walks in, it's very handicap accessible. Sanitation. So then center of Tyson Corner. Welcome to our office. Our reception area. As the patient walks in, we have space for the patient to put their jackets. They are hangers, they can put their jackets on, take off, for patient tea or coffee. They have their own refrigerator to put snacks or anything they like to do it. So this environment is made in a way that it looks more like homely office. It's just like a living room of any home.
Good job.
Good job, yeah. You did good job too. Thank you. This is our staff. They welcome the new patient and they take care of their art registrations and insurance issues. This is another working area for the staff. This is the office manager's office where they can do consultation. This is our doctor's office where doctor can sit down and discuss the patient treatment plan, plus treatment for the patient. This is inside the office where we do treatment for the patient. We have a CBCT, full mouth X-rays, which X-ray enables us to take the X-ray of the airway, so we can create a, for example here. In this picture, we can see the airway, how the 3-dimension mode of the patient structure, soft tissue structure as well as the hard tissue structure. And this helps us to diagnose properly and make the proper treatment plan whatever the patient needs. This is operatory where patient comes in and sit down. We have models to show to patient to demonstrate how it works. For example, when we are talking about the CBCT, the airway, sometimes when patients sleep, lay down on the bed, the tongue goes back and the airway gets blocked. So then in the X-ray we can see whether the airway is proper or not, and whether the patient need any appliance. In this case, if there is an obstruction, we can make the appliance which will help the tongue to be moved forward and have the patent airway so patient can sleep better. So these are called the sleep apnea appliances, so the air can flow very freely inside the lungs. And this is our microscope where it helps us to do the procedure under the magnification, especially doing root canal treatment and other microsurgeries. This is our oxygen panel sterilization area here. Another operatory. This is our surgical suite. Here we put patient under sedation, especially patients who are not cooperative with a lot of underlying conditions. And with those patients, we can give the nasal sedation in the waiting room, make them a little bit drowsy, and then bring them here. Then we give the IV fluid, and we mostly use the propofol. This equipment is fully equipped to take care of their airway and the cardiac situation. If there is any emergency, we can immediately address that one. But when the patient is done with the treatment, they don't even remember what treatment was done for them. This is X-ray. We have handheld X-ray, and as well as we have the other X-ray, panoramic X-ray. All the things are provided in the same room, and along with that, this whole electricity is powered by the backup generator. So there's no interruption in case the electricity goes off. This is our recovery room. After the patient is done, patient is brought here. For recovery, we have the quick connect for the oxygen and as well as for the suction. So patient could be treated if there is any need for additional treatment.
At Dr. Chaudhry's office here at the Tysons Corner Medical Center. Very good, nice location, easy to get to, not a problem. And people here very nice, very friendly, haven't had any problems today, and very happy to be here and real glad that I want to get a chance to use this facility.
I've known Dr. Chaudhry for many years, since I was very young, and he was extremely young, and he started his career when we knew him in the beginning here in Washington, D.C. He is a wonderful dentist, and I love this office. We used to go to Falls Church, but it's too far for us because we live in Vienna, Virginia, and this is closer to us. And I feel when we come here that I feel there's not much anxiety. I feel very relaxed, and I feel I'm in good hands. I think he's a wonderful dentist, and I love the whole staff here.
My name is Hanif Akhtar. I've been coming to Dr. Chaudhry for almost 30 years, and his office is excellent. They are very proactive, and they make you feel comfortable, and they are very cordial. The staff is excellent, and Dr. Chaudhry been progressing since I met him, and I don't think anybody else compared to him nowadays. He's so good, so excellent. I think he's a super dentist, as he said. I've been coming to Fall Church location, and now I come to Tyson Corner location because it's next to my office. Very convenient. It's a very competent doctor.
Hi, I'm Dr. Amy. I work as an associate with Dr. Maksud Chaudhry. I have been working with him for a year. We take care of the patients in Tyson's office with special needs and challenging health conditions under pilot program. I think Dr. Chaudhry is doing a great job in helping and serving the community-based patients to get other dental work done. We have a really trained and experienced staff that helps us work and manage these patients easily with less stress. And then I think the pilot program is one of the programs with Dr. Chaudhry who helps to provide an easy access to these patients under sedation and make the dental work easy and accessible for them. We usually perform the basic dentistry, and then depending on the conditions like root canals for these patients and extractions as well. I think the best thing about the pilot program is that we don't hold down the patients, and we have a great team to manage them.
Hey, my name is Rama and I came here to the office, Dr. Chaudhry, and I recommend it because I love this place. It's super clean, all the stuff very nice, and I feel in my home.
Hello, this is Zaina. I've been working here with Dr. Chaudhry for almost a year and a half, and it's been an amazing experience. So happy to help all patients with disabilities and also regular patient. We do it all here in Tyson Corner, Dental Center of Tyson Corner, and we see patients with special needs. We see patients for cosmetic work. For cosmetic dental work. All patients are happy. I'm here at the front desk taking phone calls, making appointment. I can see that patients are very satisfied with the service that we provide, and I hope we hope to see more patients in, and happy to help everybody. Thank you so much, and hopefully we see you soon.
Just to make sure our patient get informed decision, and they can make better adoption of their decision about the treatment. So we try our best to provide best possible services, not only to the patient who are coming on regular basis, but also the patient who have intellectual deficiencies and they could not be treated in other offices. So we welcome them as well in this office. We provide implant dentistry, cosmetic dentistry, full mouth rehabilitation, as well as temporomandibular joint dysfunction, which is like a patient with a TMJ, headache, pain, migraine, or vertigo, and of course the cosmetic dentistry, veneers, braces. And you are always welcome to call us anytime. Our friendly staff is looking forward to help you out. Thank you for watching. Looking forward to seeing you
At the Dental Center of Tysons Corner.